Hello everyone, this is Dr. Abinaya Vijayakumar. I am a doctor and a motherhood empowerment coach. For those who are watching me for the first time, I run positive pregnancy classes and I teach mothers how to stay confident throughout their pregnancy using simplified garbh sanskar techniques. If you'd like to know more about the courses, you can email me at the below email ID or you can check out my Instagram page. I'll provide the link in the description box. So what is today's topic? We are going to discuss the best time to get pregnant after your periods. We are going to discuss in detail about the ovulation day, how it differs with the length of your period cycle. Let's get started. First and foremost, the fertile days concept applies to women who have regular period cycle. For example, if they have a 30-day cycle, it has to repeat every 30 days regularly. If the woman has irregular period cycle, fertile period concept may not be that helpful in that woman. So what is fertile period? The days around your ovulation is called the fertile period, which increases the chances of pregnancy when you have intercourse during that time. First, let us understand the concept of period cycle very clear. Period cycle is nothing but the duration or gap between two periods. That is the first day of this periods to that of first day of your next periods. Say for example, this month first you had your periods and you have a regular cycle, and every 28 days your periods keep repeating, in which case this month 28 will be your next cycle. So in such cases, the next expected date minus 14 days will give you your ovulation day. So 28 minus 14, which is 14th of this month. So around 14th day, 2 days prior and 2 days after will be the most fertile period of your cycle. Say for example, if you have a 30-day cycle and every 30 days your periods keep repeating. So first day of this month was your last periods and you expect your next periods to be on 30th of this month. In such case, 30 minus 14, that is 16th. So 16 plus or minus 2 days, that is 14th day to that of 18th day. So 14, 15, 16, 17, 18. These 5 days will be your most fertile period. So normal periods length would be 28 to 35 days. So let us take the next extreme case where you get periods every 35 days. So this month first you had your periods and say this month has 30 days. So next month you would be getting periods on 5th, in which case 5th of next month minus 14 days, which is 21st of this month, will be your ovulation day. So plus or minus 2 days, which is 19th to 23rd will be the most fertile period. So if you have intercourse during this most fertile period, the chances of pregnancy is much higher compared to that of the rest of the month. Some couples will not be comfortable having intercourse on specific dates on a single date, which makes them very anxious. In such cases, they can have intercourse between 10th and 20th day if the woman has a 28-day cycle. So that would be the fertile period. But if you ask me most fertile period, it would be 12th to 16th day if the woman has a 28-day cycle. Ovulation day is nothing but the follicle ruptures and the egg is released. So this egg, once it is released, it stays in our body for 8 days. And when sperm is released into your body, it stays active for 3 days. So this would be that range of most fertile period to have intercourse such that it increases the chances of pregnancy around your ovulation day. Nowadays, there are so many options available to track the ovulation, including the ovulation tracker apps, which are available for free on the Play Store, or ovulation kits can be used. This is much similar to that of the pregnancy kits, but here it tracks the hormone called luteinizing hormone or LH. I will provide the links for ovulation tracker apps as well as the ovulation kits so that you can use them and get the best results. But what if the women's periods are not regular? If the women's periods are not regular and she gets once in 30 days, once in 40 days, sometimes once in 60 days, this fertile period calculator will not be of use for that woman. Why? Because when there is irregularity in your period cycle, it makes it difficult to calculate the ovulation day. In such cases, first we need to find what is the problem for irregular periods and sort out the issue, because solving the root cause will solve many problems. So reach out to your gynecologist, talk about this, and your doctor might advise you to take blood test, ultrasound scan, thyroid profile as well as semen analysis to further see what is the issue going on. If you are that couple who are not confident having intercourse every alternate days or continuously for couple of days, but you want one single day to be sure of to get chances of pregnancy higher, then follicular study will give you that result. Follicular study is nothing but series of ultrasound scans done from the third day of the periods of the women to track the growth and maturity of the follicles and rupture of follicle and see the ovum getting released. So when you have intercourse, once the ovum is released, this increases the chances of pregnancy on that particular day. Next, moving on to some of the ifs and buts as well as tips about fertile period calculator. This fertile period calculator, as I mentioned earlier, applies only to women who have regular period cycle. If you have irregular periods, fertile period will not be suitable for you. Apart from fertile period calculator, there are various natural signs that is produced from our body to prepare us for pregnancy, which when we monitor will get a good hold of our ovulation day. First is around the ovulation day, some women will experience mild pain in the abdomen, or sometimes they can even have spotting or mild bleeding. This is absolutely normal and it happens because of the hormone surge. Next, the women would have vaginal discharge, which is very specific with regards to ovulation. During ovulation, the vaginal discharge is slippery like egg white. It is very thin, and when you stretch the discharge, it forms a thin string. This is indicative of your ovulation. Last will be your body temperature. The basal body temperature is nothing but the first temperature that you get as soon as you wake up, even before getting out of your bed. That is called the basal body temperature. So when you monitor your basal body temperature every day, starting from the first day of your periods, you can notice that there is an upsurge of temperature, that is around 1 degree of temperature increases around your ovulation day. This is because of the surge of progesterone hormone, which increases the body temperature of the women. Having said all this, if you are going to be anxious throughout your cycle or around your ovulation day, sticking with the dates, very anxious to conceive but very stressful, this decreases the chances of pregnancy, because on the male counterpart as well as the female counterpart, this decreases the quality of sperm and egg. In turn, this decreases the chances of pregnancy. So conception is a natural process. This fertile period and the ovulation tracking, everything is just one way of helping you to increase the chances, but let's just keep it normal such that both of you remain calm and relaxed during this phase and have intercourse during the specific dates to increase your chances of pregnancy. I hope you found this video useful. If you like my video, do like, comment and subscribe to my channel and press on that notification bell icon so that you don't miss out on any new videos in my channel. Until I meet you in the next video, stay happy, stay momified.